Did you know that 1 in 10 people will experience a kidney stone at some point in their lives? Kidney stones, also known as nephrolithiasis or renal calculi, are one of the most common health conditions affecting the urinary system. Despite their prevalence, many people are unaware of the symptoms and potential complications associated with kidney stones. Understanding these signs and symptoms is crucial for early detection and treatment. Today, we'll delve into the comprehensive symptoms of kidney stones, exploring real-life examples and personal experiences to help you recognize and address this condition promptly. 1. Pain in the back, belly, or side. One of the hallmark symptoms of kidney stones is severe pain in the back, belly, or side, often referred to as renal colic. This pain is notorious for being one of the most excruciating types imaginable, often compared to childbirth or being stabbed. It typically begins suddenly when the stone moves into the narrow ureter, causing intense discomfort. Sarah, a 35-year-old teacher, woke up in the middle of the night with an excruciating pain in her lower back. The pain was so severe that she could barely move. Initially, she thought it might be a muscle spasm, but the pain didn't subside. As it radiated to her belly and groin, she realized something was seriously wrong. After visiting the emergency room, she was diagnosed with a kidney stone. Kidney stones cause pain when they move into the ureter, the tube connecting the kidney to the bladder. The stone creates a blockage, increasing pressure in the kidney and causing severe pain. This pain can shift location and intensity as the stone moves, often coming in waves due to the ureter's attempts to push the stone forward. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment great to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. 2. Pain or burning. During urination. As the stone reaches the junction between the ureter and the bladder, it can cause sharp or burning pain during urination. This symptom is a clear indicator that the stone is progressing through the urinary tract. Mike, a 40-year-old accountant, started experiencing a sharp pain every time he urinated. Initially, he dismissed it as a urinary tract infection, but when the pain persisted and worsened, he decided to see a doctor. Tests revealed a small kidney stone lodged at the junction of his ureter and bladder. When a kidney stone reaches the ureter-bladder junction, it irritates the bladder lining, causing pain or a burning sensation during urination. This symptom is often misattributed to other conditions like UTIs, making it essential to seek medical advice for an accurate diagnosis. 3. Frequent urination. An increased urgency to urinate more frequently than usual can be another sign that a kidney stone is moving through the urinary tract. This symptom can be particularly disruptive and uncomfortable. Emily, a 28-year-old nurse, found herself needing to urinate every hour. She initially thought it was due to increased water intake, but the frequency didn't match her fluid consumption. After experiencing sharp pains during urination, she sought medical help and was diagnosed with a kidney stone. As a kidney stone moves lower in the urinary tract, it can irritate the bladder and increase the urge to urinate. This frequent urination is the body's response to the stone's presence and the irritation it causes in the urinary tract. 4. Blood in the urine. Blood in the urine, medically known as hematuria, is a common symptom of kidney stones. The blood can appear pink, red, or brown, depending on the amount of blood present. John, a 50-year-old construction worker, noticed his urine had a pinkish tint. Initially, he ignored it, attributing it to something he ate. However, when the color persisted, he visited his doctor, who found a kidney stone through imaging tests. Healthy kidneys do not allow blood cells to pass into the urine. When a kidney stone scrapes against the delicate lining of the urinary tract, it can cause bleeding. This bleeding manifests as blood in the urine, signaling the presence of a kidney stone. 5. Cloudy or smelly urine. Healthy urine is typically clear and has a mild odor. Cloudy or foul-smelling urine can indicate an infection in the kidneys or another part of the urinary tract, often associated with kidney stones. Laura, a 45-year-old librarian, noticed her urine was cloudy and had a strong odor. Concerned about a possible infection, she visited her healthcare provider. Tests revealed she had a kidney stone and a concurrent urinary tract infection. Kidney stones can create blockages that lead to urinary tract infections, UTIs. The bacteria from these infections can cause urine to become cloudy and develop a strong odor. It's essential to address these symptoms promptly to prevent complications. 6. Small amounts of urine. Producing only small amounts of urine at a time can be a sign that a large kidney stone is obstructing the ureter. This blockage can slow or stop the flow of urine, posing a significant health risk. David, a 55-year-old mechanic, found that despite the urge to urinate frequently, he was only passing small amounts of urine. This continued for several days until he experienced severe pain and sought emergency medical care. Doctors discovered a large kidney stone blocking his ureter. A large kidney stone can obstruct the ureter, preventing urine from flowing normally. This blockage can lead to decreased urine output and requires immediate medical attention to avoid kidney damage. 7. Nausea and vomiting. Nausea and vomiting are common symptoms among individuals with kidney stones. These symptoms occur due to the shared nerve connections between the kidneys and the gastrointestinal tract. Rachel, a 30-year-old chef, began experiencing severe nausea and vomiting along with abdominal pain. Initially, she thought it was a stomach bug, but when the symptoms persisted, she sought medical advice. An ultrasound revealed she had a kidney stone. The kidneys and gastrointestinal tract share nerve pathways. When a kidney stone causes significant pain, it can stimulate these nerves, leading to nausea and vomiting. These symptoms are the body's response to the severe discomfort caused by the stone. 8. Fever and chills. Fever and chills are signs of an infection in the kidneys or another part of the urinary tract. This can be a serious complication of a kidney stone, requiring immediate medical attention. Tom, a 60-year-old retiree, developed a high fever and chills along with severe back pain. His doctor immediately suspected a kidney infection and performed tests that confirmed a kidney stone with a concurrent infection. Tom was hospitalized for treatment to prevent further complications. A kidney stone can cause a urinary tract infection, leading to fever and chills. This infection can spread and become severe if not treated promptly. Fever combined with kidney pain is a medical emergency that needs immediate attention. 9. Persistent pain. Persistent pain that does not subside with medication can indicate a kidney stone that is not passing on its own. This type of pain often requires medical intervention to alleviate and remove the stone. Ben, a 48-year-old lawyer, experienced ongoing pain despite taking over-the-counter pain relievers. His doctor recommended a CT scan, which revealed a large kidney stone that required surgical removal. Ben's pain significantly improved after the procedure. Persistent pain suggests that a kidney stone may be too large to pass through the urinary tract on its own. Medical treatments, such as shockwave lithotripsy or surgical removal, may be necessary to alleviate the pain and remove the stone. 10. Loss of appetite and weight loss. A decreased appetite and unexplained weight loss can be indirect symptoms of kidney stones, often due to the associated pain and nausea. Susan, a 40-year-old writer, noticed she was losing weight and had little interest in food. She also experienced intermittent pain and nausea. After visiting her healthcare provider, she was diagnosed with a kidney stone. Addressing the kidney stone helped her regain her appetite and stabilize her weight. The pain and nausea associated with kidney stones can lead to a reduced appetite and weight loss. Managing the underlying kidney stone can help alleviate these symptoms and improve overall health. Steps to lower your risk of kidney stones. Preventing kidney stones involves several lifestyle and dietary changes. Here are some steps you can take to lower your risk. 1. Stay hydrated drinking. Plenty of water is one of the most effective ways to prevent kidney stones. Staying hydrated helps dilute the substances in urine that can form stones. Mark, a 50-year-old athlete, made it a habit to drink at least 8 glasses of water a day. After experiencing a kidney stone, he increased his water intake and added lemon juice to his water to help prevent future stones. This simple change significantly reduced his risk. Adequate hydration helps dilute the concentration of minerals and salts in urine, reducing the likelihood of stone formation. Aim for at least 2 to 3 liters of water per day and consider adding lemon or lime juice to help prevent stones. 2. Maintain a healthy diet. A balanced diet that is low in oxalates, sodium, and animal protein can help prevent kidney stones. Incorporate plenty of fruits, vegetables, and whole grains into your diet. Lisa, a 35-year-old nurse, adjusted her diet after her first kidney stone. She reduced her intake of high oxalate foods like spinach and nuts and increased her consumption of fruits and vegetables. This dietary change helped her prevent further kidney stones. Certain foods high in oxalates, such as spinach, nuts, and chocolate, can contribute to kidney stone formation. Reducing intake of these foods and increasing consumption of calcium-rich foods can help prevent stones. Additionally, limiting sodium and animal protein can reduce the risk. 3. Monitor your sodium intake. Excessive sodium intake can increase the risk of kidney stones by causing calcium to build up in the urine. Aim to consume no more than 2,300 milligrams of sodium per day. James, a 45-year-old accountant, used to consume a high-sodium diet. After experiencing a kidney stone, he started reading food labels and reducing his sodium intake. This change helped him prevent additional stones. High sodium intake can cause the kidneys to excrete more calcium into the urine, increasing the risk of stone formation. Reducing sodium intake helps lower this risk and supports overall kidney health. 4. Limit animal protein. Eating too much animal protein can increase the risk of kidney stones. Consider reducing your intake of red meat, poultry, and seafood. Karen, a 40-year-old chef, frequently ate red meat and seafood. After being diagnosed with kidney stones, she reduced her animal protein intake and incorporated more plant-based proteins into her diet. This change helped her avoid future stones. Animal protein increases the level of uric acid and reduces the level of citrate, both of which can contribute to kidney stones. Reducing animal protein intake and increasing plant-based proteins can help prevent stone formation. 5. Increase calcium intake. Contrary to popular belief, reducing dietary calcium can actually increase the risk of kidney stones. Ensure you get enough calcium through your diet to prevent stones. Nancy, a 55-year-old teacher, initially reduced her calcium intake after her first kidney stone. Her doctor advised her to increase her dietary calcium instead. By consuming more dairy products and leafy greens, Nancy reduced her risk of future stones. Adequate calcium intake binds with oxalates in the gut, preventing them from being absorbed into the bloodstream and forming stones. Aim for 1,200 milligrams of calcium per day through diet rather than supplements. 6. Avoid high oxalate foods. Foods high in oxalates can contribute to kidney stone formation. Limit your intake of high oxalate foods such as spinach, beets, and nuts. Tom, a 30-year-old engineer, loved eating spinach salads and nuts. After experiencing a kidney stone, he reduced his intake of these high oxalate foods and replaced them with lower oxalate options like cauliflower and apples. This change helped him prevent future stones. Oxalates can bind with calcium in the urine, forming calcium oxalate stones. Limiting high oxalate foods and pairing them with calcium-rich foods can help reduce the risk of stone formation. 7. Avoid excessive vitamin C supplements. High doses of vitamin C supplements can increase the risk of kidney stones. Stick to the recommended daily allowance of vitamin C to avoid this risk. David, a 60-year-old retiree, used to take high doses of vitamin C supplements to boost his immune system. After developing a kidney stone, his doctor advised him to reduce his vitamin C intake. By sticking to the recommended daily allowance, David was able to prevent further stones. Vitamin C can be metabolized into oxalate, increasing the risk of kidney stones. Stick to the recommended daily allowance of 90 milligrams for men and 75 milligrams for women to avoid excessive intake. 8. Manage medical conditions. Certain medical conditions, such as diabetes and high blood pressure, can increase the risk of kidney stones. Properly managing these conditions can help prevent stones. Laura, a 50-year-old teacher with diabetes, worked with her doctor to manage her blood sugar levels effectively. By keeping her diabetes under control, she was able to reduce her risk of developing kidney stones. Medical conditions like diabetes and high blood pressure can affect kidney function and increase the risk of stone formation. Proper management of these conditions through medication, diet, and lifestyle changes can help prevent stones. 9. Consult a healthcare provider. If you have a history of kidney stones or are at high risk, consult a healthcare provider for personalized advice and monitoring. They can recommend dietary changes, medications, and lifestyle adjustments to help prevent stones. Emily, a 35-year-old graphic designer, had a family history of kidney stones. She regularly consulted her healthcare provider, who monitored her kidney health and provided personalized recommendations. This proactive approach helped Emily prevent stones and maintain good kidney health. Regular consultations with a healthcare provider can help you stay informed about your kidney health and take proactive steps to prevent stones. They can provide personalized advice based on your medical history and risk factors. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment great to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Kidney stones are a common but painful condition that can significantly impact your quality of life. Recognizing the symptoms and understanding the risk factors are crucial for early detection and prevention. By staying hydrated, maintaining a healthy diet, monitoring sodium and animal protein intake, and consulting a healthcare provider, you can reduce your risk of developing kidney stones. Remember, proactive steps and informed choices are key to maintaining good kidney health. If you experience any symptoms of kidney stones, seek medical attention promptly to avoid complications.